So there is a new case
Okay.
with failed full mouth rehab. She has been referred to us from US. The doctor knows you, and she's a high-profile case. All her previously done root canals and ridges are failing. These are her CVCT reports. What will be the plan of action?
Like, what is the major chief complaint?
She wants replacement of all the bridges.
Like, why? What is the reason? Like,
It's coming off.
It's coming off.
They're failing. They're coming off. She needs her smile to be good.
The failing bridges and the smile makeover, she want to get it on. Seeing all these X-rays, like everything that got fractured. Here it got fractured. There is pus everywhere filled here. Here also there is a pus formation. Here, if you can see, like there is a complete chipped off, and there are no teeth, no bone. In the posterior area, there is no bone at all. Only like 10 to 12 teeth are replaced here, and it's a completely failed rehabilitation case. Means like she got her rehab done before, but it failed on every level because they didn't consider the parameter of occlusion. So like maybe the occlusion is not at all considered. That's the reason why everything everywhere is chipped off and failed. So I don't think like we'll be able to save this thing at all. So the teeth on the upper quadrant are like very less chances to save, because like out of 10 to 12 teeth here, almost 9 teeth are fractured. So it's better to go for rehabilitation of the upper complete arch. So we'll rehabilitate the upper complete arch with implants. So we'll plan for upper complete rehabilitation with implants. You explain her very much well, like take her complete medical history, like whether she's using any medications or not, like whether she's allergic to any medications or not, and like since last 5 to 8 years, like any hospitalization. So like complete history regarding her medical concerns, and like you take the pictures of her intraoral areas and see if there are any pus drainage everywhere, any infections are there. So then accordingly from there we will start planning her implant procedures.
Okay, so since there's no bone, how do you suggest the treatment be?
So like we will plan for because if you have to rehabilitate this particular procedure, then either we have to go for a sinus lift. And at this particular age, owing to her medical conditions, like I'm not so much inclined to go for a sinus lift because there is good amount of bone here. So we will just place like 6 implants here, and if she want more amount of tooth support, then we'll engage 2 more implants here. So totally we'll put 8 implants, that is like pterygoids here, and 6 implants here, and we'll rehabilitate so that we can give the full set of arch. For example, if the pterygoid bone is not so good, then we can just put 6 implants here, and then we can engage the full arch.
How do you think we can increase the precision for placing the pterygoids, and how do you think we can incorporate digital dentistry in this?
We'll get the splints done, like for example 3D models, and we'll get a 3D model guide. So this is a guide in which we are planning ahead today, and here we're going to put 1 implant, here we'll put 1 implant, and here 1, 2, 3, 4, 5, 6.
Good.
So the precision of this particular case will be very much good if you are using the 3D models, and if you are using the digital technology to develop a guide. First we'll take a digital scan for the patient, point number 1, and after that we will get a 3D printed maxillary jaw.
Okay.
And we will get the jaw of hers, like we'll get a 3D printed, and then we'll make 1 guide, so that this guide will tell us, or the implantologist, where he's going to put an implant. So he's not going to put an implant blind, like what is the size of the implant, height, width, everything. For example, if he has to place an implant in this particular area, so we're going to keep the guide inside the oral cavity of the patient, and then we're going to drill accordingly. So we are not going to damage the major tooth structures, like major anatomical structures or anything. So we'll be very much precise, and the treatment will be more predictable. Point number 1. And we are printing the 3D maxilla of the patient, so we will understand the adaptability of even the guide, like how exactly we can keep and how to put an implant. So overall, the digital dentistry is like very much helpful in these kind of scenarios, and that will help us to gain more amount of predictability in particular case. And after all these scenarios, let's assume we placed implants and everything, then we're gonna scan, we'll put the scan bodies, and we'll take the scan, and we'll start fabrication of the teeth within a span of 3 to 4 days.
Perfect.
Like once we achieve the primary stability within a span of 3 to 4 days, like within a span of the preliminary healing, like once the preliminary healing is completed, then we'll start fabrication of the teeth. So the patient will not have teeth like for long duration of the time. So like we are going to minimize that particular time, and we are going to enhance this particular modality.
Okay, after the thorough medical history is done, we discovered that the patient is a little bit medically compromised. So how do you plan it? Like,
Okay.
what can you do to decrease the complications?
Yeah. So like what I'm trying to tell you, let's form one team. Let's have an anesthetist, one emergency doctor, and for example, like one implantologist. Let's call all our team of doctors and one surgeon and one implant prosthetic specialist. And after that, along you and me also will be there in this particular case who will be handling. So the emergency doctor will be able to handle if there are any inadvertent emergencies that's going to pop up, like for, with respect to the patient's medical history or anything. Generally, it won't happen, but we should be ready for everything. Like the worst case scenario, we should be ready. And the anesthetist will be doing the patch test. He'll be understanding what kind of anesthesia will suit the patient, or if there is any chances of overdosage. So we'll keep a track of all the anesthesia, what you are giving, what kind of drugs we are giving. So the surgeon will be able to remove all the root pieces, the infections and everything. So implantologist will help us to place the guide, and along that the implants will be placed. And once everything is done, implant prosthodontist, like specialist who is fabricating the teeth after placing an implant, so she will take care the entire management of how to keep the teeth, like on which direction. The most important point that we need to understand is like what made her to have this kind of scenario. That's because of the poorly made prosthesis. Point number one, poorly planned treatment modality without engaging the back teeth. So the occlusion has to be very much considered even while we are doing the permanent prosthesis. We need to take all this parameter and then a success will be seen. There is a saying that it's not diagnosis and treatment planning, it's diagnosis, planning and the treatment. It's like very much more important. So first we diagnosed, then we took all the history, then we're gonna plan, and then we're gonna implement the treatment.